Hi there, I'm Dr. Gawel at Indian Trail Animal Hospital. Today we're going to talk about the role of anesthesia in our feline friends. The goals are to cover what exactly is anesthesia, why do we need it, and how can we make it as safe as possible for your cat. So let's get started. So what exactly is anesthesia? It's basically using a combination of injectable medications with inhaled gases to put your cat in an altered state of consciousness. So basically think of it as your deepest, best sleep. We don't want these guys waking up during a particular surgical or procedure. So why exactly do we need it? Well, we have elective procedures like a spay, dental cleanings, removal of oral masses, or oral surgeries. We have a lot of internal or intra-abdominal procedures like foreign bodies, biopsies, bladder stone removals that it's important for. And then, of course, things like biopsies on the outside, mass removals. We can even get into things like fracture repairs. All very important role of anesthesia for your cat. Anytime I talk about anesthesia with my clients, I know there's always a little bit of trepidation and hesitation. So what can we do to make it as safe as possible? Well, we start with a PreAnaesthetic examination. So we're listening to the heart and lungs, checking out the whole body appearance, making sure that that cat's healthy enough for anesthesia. I want a complete blood work prior to going under anesthesia. This is a way to evaluate the kidneys, the liver, all those internal organ structures to make sure that this is a good choice and they'll be able to handle the medications we use for anesthesia. At Indian Trail Animal Hospital, we perform a PreAnaesthetic ECG. This is a tool we use to monitor and record the electrical activity of the heart. It is reviewed by a veterinary cardiologist to make sure that there are no problems with the structures or the heart itself. Prior to going under anesthesia, an IV catheter is placed usually in the front arm of your cat. This is not only a way that we use to induce or put that cat under anesthesia, but it's also a port for things like fluid therapy to maintain hydration, blood pressure. It's also a port of medication if we need it. If you have any experience in the medical field, you've been in a hospital yourself, or you're a fan of the evening drama television, hospital dramas, you're very familiar with the tools we use to make sure that your pet is doing well under anesthesia. We can check things such as the heart rate, the ECG, the blood pressure, the oxygen levels. We use heating pads to make sure that that cat is staying warm under anesthesia. So all of these tools can make sure that things are going well and anesthesia is proceeding safely. We have a surgical team member that is regularly monitoring and recording these values from these tools so that if there is a problem, common complications of anesthesia would be an increase or decrease in heart rate, an increase or decrease in blood pressure, decreasing oxygen levels, decreasing temperature or increasing temperature. If any of these problems are recorded or found, we can address and proceed with the surgery safely. Last but of course not least is a surgery team member stays with your cat all the way through the procedure as well as during the recovery process. So they don't leave their side until that cat is fully awake and done with the procedure. So what's your job when you bring your feline friend home? It's to offer a lot of TLC. Usually we recommend finding a quiet, dimly lit or dark area of the home. It's best to have kind of a smaller area, not a lot of areas for them to jump or hide or run around. It's best to keep them away from other housemates or pets in the homes and limit as much noise as possible. So things like a loud television, stereo, loud children would be best to keep them away at that time, just for about 12 to 24 hours. And if you can bring close proximity access for food and water, if that's appropriate from the procedure they had that day, as well as a litter box, this can also be helpful for your cat. If you have any questions or concerns about anesthesia with your cat, please give us a call at Indian Trail Animal Hospital today.